Welcome. In this video, we will begin our exploration of the science and treatment of psychological disorders. In this Chapter 1 discussion, we will be getting a brief introduction as well as a historical review of science and treatment of psychological disorders. We will begin by discussing what are psychological disorders and stigmas, as well as coming up with a good scientific definition of psychological disorder. We will explore the early history of psychological disorders, as well as some of the historical antecedents of contemporary views. We will seek to answer the question, so have we learned from history? And we'll also discuss the mental health professions. We will begin by coming up with a definition of the term psychopathology, which is the field that's concerned with the nature, development, and treatment of psychological disorders. Also, we will talk about what is a stigma. That's destructive beliefs and attitudes held by a society that are ascribed to groups considered different in some way. So psychological disorders, they remain the most stigmatized condition of the 21st century, despite advances in scientific understanding and public knowledge of the origin of psychological disorders. We will begin by discussing the four basic characteristics of stigma. And you can see on the upper left-hand side here, it says distinguishing label is applied. Okay, and then just to the right of that, label refers to undesirable attributes. Proceeding further to the right here, people with the label are often seen as different. And then people with the label are discriminated against. And that results in what we call stigma. Now, what we're going to discuss coming up in just the next slide here is how do we reduce the possibility of stigma? So even though people's knowledge has increased, but stigma still remains a problem, particularly for psychological disorders. So coming in contact with someone with a severe mental illness can help reduce stigma. And social media, websites, blogs, they share personal stories, they raise awareness and increase social connectedness. But those resources can also increase stigma depending on how it is used. So public figures that speak about their experiences with mental illness may help to reduce stigma by humanizing mental illness. So one question we can sort of ponder is, do reality TV shows depicting psychological disorders educate or perpetuate stigma? So let's define the term psychological disorder. So the DSM-5, that's the Diagnostic and Statistical Manual of Mental Disorders. Here's the definition according to that manual. The disorder occurs within an individual. It involves clinically significant difficulties in thinking, feeling, or behaving. And it usually involves personal distress of some sort, such as in social relationships or occupational functioning. It involves dysfunction in psychological, developmental, and or neurobiological processes that support mental functioning. It is not a culturally specific reaction to an event, and it is not primarily a result of social deviance or conflict with society. Let's go further. So there are three basic characteristics of a comprehensive definition of a psychological disorder. And first, on the left-hand side right here, we see the term personal distress. Means a person is experiencing distress, discomfort. Okay, and then just to the right of that, you see violation of social norms. So they might be behaving in a manner in which it might not be socially acceptable, or what usually occurs within their social society. Okay, and then right here it says disability and dysfunction. So that is one characteristic of a psychological disorder. A person might be experiencing some psychological disability and or dysfunction. And all of these characteristics, they all lead to what is called psychological disorder. So let's take a moment and talk about some of these a little more in detail here. So how about personal distress? That's a person's behavior causes significant personal distress. So here's some examples of distress, like emotional pain and suffering, distress over impact of symptoms on functioning. And not all psychological disorders, they don't all necessarily cause distress. So a person, for example, might exhibit what we call antisocial personality disorder. That's when an individual may violate the law without guilt, remorse, or anxiety. Okay, and then down below here I said not all behaviors that cause distress are disordered. For example, like distress of hunger due to maybe religious fasting. So we mentioned disability here, so let's go a little bit more in detail about disability. That is an impairment in an important area of life. For example, one's work, one's relationships, and things like chronic substance abuse disorders, resulting in job loss or rejection by peers due to social anxiety. Those are all disabilities. But not all psychological disorders involve disability, and not all disabilities are psychological disorders. Let's talk about dysfunction. So that is developmental, psychological, and or biological systems where something has gone wrong and it is not working as it should. So these systems are interrelated, and dysfunction in one can influence dysfunction in another system. We will discuss some of the early history of psychological disorders, things like supernatural explanations. In the early days, they didn't have the science from which to look into some of these disorders, and so they had supernatural explanations. So for example, displeasure of the gods or possession by demons. So some of the treatments that they used before the field of psychology evolved into what it is now. But in the early days, they did things like exorcisms, casting out the evil spirits. And let's go just a little bit further on this. So one person I'd like to make you aware of was Hippocrates. And he said, though, that mental disturbances have natural causes, we call that brain pathology. So the Hippocrates said that there are 3 categories of mental disorders, which are mania, melancholia, and phrenitis, which is brain fever, they called that. And so he also said, though, that healthy brain functioning depends on 4 what he calls humors, and that is blood, black bile, yellow bile, and phlegm. And then the treatment that Hippocrates used was restoring their natural balance, helping people to restore their natural balance. Like, for example, establishing a feeling of tranquility, sobriety, care in choosing their food. Let's go a little bit further in the history here of this part of psychology. Okay, so you can see, back in the Dark Ages, they were going back to the supernatural. And so Christian monasteries replaced physicians as healers. They returned to the belief of supernatural causes, and treatments included being cared and prayed for by monks, touching with relics, and drinking potions in the waning phase of the moon. Now, in the early part of the 13th century, they held what was called lunacy trials. And those were held to determine a person's mental health. How their orientation, how they exhibited orientation, how they fit in with their society, their memory, their intellect, their daily life and habits, as well as a strange behavior that was attributed to physical illness or injury. And you can see at the bottom here, I said, well, lunacy, that term, that was attributed to insanity because of misalignment of the moon and stars. Okay, let's go further here. All right, and then in the 15th century, they started developing what was called asylums. And those were establishments for the confinement and care of people with psychological disorders. And in these early phases of psychological treatment here, various people, they did things like drawing blood to relieve brain pressure, or using fear as a cure to convince the patient that death is near. Just some examples here, everybody. If you would like to look at this in more depth, feel free to pause the video and look at each little bit individually. Okay, so in the 1700s through the early 1900s, there was this person, Pinel, and he was basically engaged in reformatic processes, or processes of reform. And he pioneered the humane treatment of individuals who were in asylums. He felt that people should be approached with compassion and dignity. And during these times, humanitarian treatment was often reserved for the people in the upper class. And there's another person I'd like to acquaint you with, and that is right here, Dorothy Dix, 1800 through 1887. And she improved conditions for people. She helped people with psychological disorders and improved their life conditions. She established 32 new public hospitals, as well as putting together small staffs at the public hospitals that could not provide necessary individual attention. That was a hallmark of moral treatment, but at least it was a work in progress. Another approach to this study was defining biological approaches. So discovering brain and behavior in the relationships. So what I'd like for you to do is just be aware that there is a little bit of overlap in this. So the brain functions, and that might cause certain behaviors to exhibit, as well as vice versa. Certain behaviors might cause certain things in the brain to function in a certain manner. So I'll give you some examples here. Anatomy and working of the nervous system, partially understood by the mid-1800s. So further insight into the working of the nervous system. And during this time, in the mid-1800s, several discoveries were, linked to the areas of the brain, to specific behaviors. But not enough was known to conclude whether structural brain abnormalities actually cause psychological disorders. So we can't claim a causal link. All right, so causal links is established between infection, damage to certain areas of the brain, and behavior associated with psychological disorders. So when I use this term causal link, I'm referring to if this happens here, this causes an effect there. So the big takeaway from this slide right here is we always want to keep in mind there might be biological causes of mental disorders. So that gained credibility. Continuing on with our discussion in regard to the biological components of psychological disorders, it's important that we always keep in mind, though, that there might be a genetic component. And we call this genetic inheritance, the genes that you inherit from your friends, your family, or your parents. Once again, feel free to pause the video and look this in detail, okay? So some of the biological treatments that kind of developed in the evolution of psychology were insulin coma therapy, electroconvulsive therapy, that's still used today. Inducing epileptic seizures with electric shock, as well as prefrontal lobotomy. And that was in the early 1900s. But that is often used to control, people with violent behaviors, so to control their behavior. But people who receive a lobotomy, they become listless, apathetic, and they might demonstrate some loss of their cognitive abilities. There might be cognitive decline. So we've talked about some of the biological components. Now let's talk about some of the psychological approaches. So we see, the first person here, Mesmer, he said that hysteria was caused by a disruption of a universal magnetic fluid in the body. So he used rods and stares to influence the fluid and induce behavioral change. And he was also an early practitioner of what is known as hypnosis. And then in the early 1900s through the mid-1900s, this person, Charcot, his support legitimized hypnosis as a treatment for hysteria. So this is one treatment I want to make you aware of, okay? So let's go ahead and go a little bit further here. So two people here, Breuer and Freud. Okay, let's start with Breuer here. He used hypnosis to facilitate catharsis in a woman with hysterical symptoms. And that cathartic method, by the way, that's the release of emotional tension triggered by expressing previously forgotten thoughts about an earlier emotional trauma. So releasing thoughts. Okay, and then another very influential individual, Sigmund Freud, in the mid-1900s to the early 1900s. He was the father of psychoanalytic theory. And he had the view that psychopathology results from unconscious conflicts that one developed as they were a young person, young child, and then through their interaction with others, they developed these conflicts, and then it went into their unconscious minds, and then it affected them maybe at a later point in their development, in their lifespan. So Sigmund Freud also was responsible for this right here. What he said, the mind is divided into three principal parts, what he called the id, the ego, and the superego. And he said that those are always in conflict. They are continuously in conflict. And that causes anxiety with individuals. And as far as treatment goes, Sigmund Freud said that there are certain defense mechanisms that we engage in, and that is strategies used by our ego to protect itself from anxiety. So let's look a little further into these, the id, the ego, and the superego coming up. So first and foremost, the id is, Sigmund Freud said, it's present at birth, that is biological and functions on an unconscious level, and it seeks immediate gratification. So when the id is not satisfied, tension is produced, and the id drives a person to get rid of tension. For example, eating when hungry. Okay, the second component, according to Freud, was the ego. And the ego, according to Freud, he said that that is primarily conscious, works on the conscious level. Okay, and then down at the bottom here, we've got the superego. And Freud says that's a person's conscience. develops as we incorporate parental and society values. So some examples of those defense mechanisms that were mentioned a little bit earlier, defense mechanisms might be these here, things like repression, denial, projection, displacement, rationalization. We will not be discussing those in vivid detail, but please stop the video and look at these at your own pace. Let's continue to talk about psychoanalysis or psychoanalytic theory here. So what are the goals of psychoanalysis that were developed by Sigmund Freud? And so he said, well, we need to understand early childhood experiences, the nature of our key relationships, the social interactions that we have with others, and the patterns in the current relationships. And so when one visits with a therapist that engages in psychoanalytic theory or therapy, the therapist is listening for like core emotional and relationship themes. And another goal is to keep in mind and keep on the lookout for what they've called transference. And that is responding towards an analyst in a similar way as toward important people in the person's past. So no formal research has been conducted on the causes and treatment of psychological disorders based on psychoanalytic theory. And that might be because there's really not a biological component. Okay, current psychology still uses some of the psychoanalytic therapies developed by Sigmund Freud. So he has a continuing influence. So the takeaway from this frame right here is at the very bottom. I put this in red font here. It says psychoanalysis and more modern variants, for instance, psychodynamic therapy, are still practiced today. In the evolution of psychology, this field was evolving, and so some psychologists, they said, well, I think the previous psychologists, everything they had to say might be valid, but I'd like to look into this just a little bit deeper. And they came up with other approaches, like a person that came up with this term behaviorism, which they said that focusing on a person's observable behavior is would be a way that to approach psychological understanding. And so psychologists have determined that there are three types of learning, by the way, and they call those classical conditioning, operant conditioning, and modeling, which I have put together previous videos for you if you feel like researching this on your own time. So we'll start off by talking a little bit about classical conditioning. That was Ivan Pavlov who was responsible for the genesis of this. But please feel free to pause the video and look at this and take notes on your own time, okay? Now let's go just a little bit further. So after taking a look at Ivan Pavlov's classical conditioning, there are other psychologists who, in the late 1800s, early 1900s, developed other types of conditioning, had other perspectives. And one of those was Thorndike. And they called this operant conditioning. So learning through our own consequences of our actions. And Thorndike said there is a law of effect. That's our behavior that is followed by satisfying consequences will be repeated and encouraged. But behavior that is followed by unpleasant consequences will be discouraged. And there are terms for those dynamics, by the way, coming right up. So Skinner called this the principle of reinforcement. And so reinforcement just means that the consequences of your actions might be desirable and that you will continue to engage in that behavior. Now, as you can see, there are different types here, and I've gone through these in extreme detail in other videos. So feel free to research those. Now, psychologists, they have another term they call modeling. And that's when we learn by watching others and then imitating their behavior. So simply just observing, watching, and then imitating. So let's go into the component known as cognition. So cognition is basically how we think about a situation, okay, and how our thinking influences our feelings and behaviors. So in the 1960s, the study of cognition really rose in popularity. So studying cognition informed the development of what is known as cognitive behavioral therapy. And that is still used these days in therapy. So cognitive behavioral therapy, here's some components here. How people construe themselves and the world can be a major determinant of their psychological disorders, as well as focusing on becoming more aware of their own maladaptive thoughts. So the therapist will become kind of like a mentor, helping them to become more aware or self-monitor their thoughts. And then the therapist here might also change the cognitions to change feelings, helping the individual. So this is a team effort here, by the way. Just know that the actual therapist is not just giving orders and saying, you must do this, you must do that. They are helping the person to think about things, they're cognitively speaking, and understand that they may be engaging in maladaptive thoughts, and then slowly change their own feelings, behaviors, and symptoms consciously. So one component here of cognitive behavioral therapy is helping the individual becoming aware of their cognitive processes or maladaptive thoughts. And so helping them to engage in what is known as appraisal. And appraisals can, help them change the meaning of a situation. So appraisal means, how are you interpreting what is going on in your life? Your personal interpretation, the meaning that you are giving to the dynamic. Okay, so what have we learned from the history of development of psychology? Well, we made several advancements and still have much to learn. So the field of psychology is constantly in a work in progress, but helping to treat mental health patients with greater compassion and respect, helping to improve their hospitalization and treatment practices, but there are still some issues, though, that we want to be aware of, and those might be medication side effects and even the capacity to access hospital resources. They might not have enough money. They might not, they might be a little bit low on what we call the socioeconomic spectrum. Okay, and then you can see on the next to the last item, I said that people with psychological disorders, they're more likely to be housed in jails than hospitals due to gaps in available services. And so society, you remember, we talked about this, people with mental health disorders might not receive the support that they need. So many people with psychological disorders are not able to work, they have very little income, and they have limited housing resources. So they might even be homeless. So a way that psychologists, contemporary psychologists, they try to look at this, everything through the lenses of the biological, psychological, and social influences on their mental health. And we call this the biopsychosocial model. Okay, so let's talk about a few different types of therapists, what they might be. So they might be clinical psychologists or counseling psychologists. So they usually have an advanced graduate training in the assessment and diagnosis of psychopathology and how to practice psychotherapy. Some might have what is known as a PhD, or what is called, you see this in red font, a PsyD, psychological doctorate in clinical psychology or counseling psychology. Okay, so that's psychologists. Now let's take a look at psychiatrists on the other hand. What is the difference? Well, psychiatrists are people with medical degrees, and they have postgraduate training in diagnosis and pharmacotherapy. So they can prescribe medications, and they might receive training in psychotherapy, but maybe not as intensely as those who they got their degree like maybe a PhD or a PsyD or something. So let's talk about psychiatric nurses. Those are people with bachelor's or master's level training, and they are nurse practitioners, receive specialized training to prescribe medications that we call psychotropic medications. All right, the next one we're going to look at is what's known as social workers. And social workers, they have a master's degree in social work. And their focus of training is on psychotherapy or counseling, but some offer training and certification in marriage and family therapy. And this concludes this video. So feel free to review it and pause on the insightful slides and take your notes and look for the next video coming up soon.